Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Kim Klimek, who is a licensed pharmacist, certified hormone replacement therapy specialist, and certified functional and lifestyle clinician coach. Kim's personal journey of struggling with endometriosis, hormone and gut-related issues, stress, and multiple surgeries is what led her to seek information about root cause medicine strategies. Specifically, after her second laparoscopic surgery for endometriosis removal, she was given a book by a coworker that focused on a more natural approach to healing that truly changed her life and led her to questioning a lot more of what she was educated on in grad school regarding medicine and health. She instantly knew that she couldn't turn her back on the power of supporting the body through a more holistic approach, and now she does that for others as well. Through her business, Innate Healing Performance, Kim specializes in helping others with hormone-related issues, gut and digestive imbalances, autoimmune and chronic health conditions, and for those looking to optimize their wellness so they can live vibrant, healthy, energized lives. Outside of her professional life, Kim loves reading, cooking, researching, training for triathlons, which is swimming, biking, running races, and spending time with her family. This 4-part series with Kim is jam-packed with explanations, tips, and science behind many of the hot topics of functional medicine, as we cover Kim's health journey and an overview of functional medicine in Episode 1, Functional Medicine's Approach to Gut Health in Episode 2, Balancing Act, Women's Hormones Explained in Episode 3, and environmental toxins and their link to autoimmune or chronic illnesses in Episode 4. Kim is a super deep wealth of knowledge. She has a ton of certifications, and she is making a difference to so many people already in our area, and we can't wait for you to learn from her. So let's get started with today's episode. Hey everybody, welcome back to the podcast. We are excited to welcome Kim Klimek today. Hi Kim, how are you?
Hi, I'm doing good. Thanks for having me.
Yeah, we're so excited to chat with you today. And we're going to start by just learning about what functional medicine is and what it means when we say it's a root cause approach. But I think before we dive into that, we want to hear a little bit about your story because you have quite the story to tell and it probably has led to where you are today. So let's start with that.
Yeah, for sure. My story is definitely my why. It is absolutely 100% my why. Where to begin? Honestly, so I'm a licensed pharmacist, and a lot of people are sometimes they kind of question how I got to doing what I'm doing now. But I'll kind of just start from the beginning. I grew up in a little town 50 miles north of Green Bay, and my grandmother, she was a community health representative for our tribe in Michigan, and when I was little, I remember going up there and just visiting for family events. And my grandmother, she would just tell us stories about how she went into the community and gave out vouchers and she would go to people's homes and kind of take their vitals and do things that a nurse does, but in their homes. And then kind of, I would say some of the sickest people, they would get vouchers to be able to go see the physician. And I really liked that, hearing just kind of her connection to medicine. And my mom is actually, for many years, she was a medical transcriptionist for physicians. So she always had just kind of anatomy and physiology books laying around the house. And, you know, as I got older and went, when I was in high school, I did a lot of like job shadowing and kind of shadowed some of the community pharmacists in the area. They were always kind of very friendly and pleasant. There was a little local hospital in town and I went and shadowed there. And there was a lot of like positivity for being able to do this as a career, but not directly having to be a doctor, because I didn't know if I wanted to I don't know if I really wanted to do a lot of the kind of like hands-on portion of what a doctor involves. So I was like, okay, I think I can still be involved in science and medicine. And that kind of led me to going down the route of getting my pharmacist license. And so I was in school. I went to undergrad at UW Stout in Menominee in Wisconsin. And I think during my last year studying, I was studying abroad actually in Costa Rica, my final year of undergrad. I had been accepted into pharmacy school at UW-Madison. I was going to study abroad at in January, and it was my final semester. I went to go study abroad in Costa Rica. I was there for probably about 2 weeks. We did for the undergrad study, and it was just for like a business minor that I was doing. And when I came back, I have to say, kind of preface that I was sort of oblivious to a lot of like health things that you should be doing for your body when you go overseas, such as, making sure you're drinking clean water and using clean water like to brush your teeth and all those things. I think a lot of people, they take little like antimicrobials and things with them when they go overseas. So anyways, I didn't really have any of that kind of knowledge, and definitely wasn't practicing the best like hygiene habits and things like that with water. And so when I got back, I had started to develop just kind of some severe digestive issues. And one day, I started having a lot of viral symptoms at bedtime, night sweats and cramping and extreme like inflammation and bloating in my stomach. And I came from kind of a background where we don't go to the hospital if you're sick unless you're like dying. So I was kind of in my mind, okay, I'm not going to go to the emergency room. I'm kind of just going to sweat this out. Everything's going to be fine. And, luckily my body was able to do that. But these symptoms kind of lasted. They were definitely like viral type symptoms, and they lasted for about a week. After the week subsided, luckily my body was able to fight it off. But I kind of woke up and I had such extreme digestive issues after that. So where it was like I was eating food and I was kind of throwing it up, or I wasn't going to the bathroom for like weeks. And I ended up losing like 30 pounds within a month. And I started,
oh my goodness.
Yeah, it was a tremendous, like people knew something was going on. But that was when I started, I would say, we call it doctor hopping, but I started going to all these doctors between my like final classes. So I would like drive home to Green Bay where my family lived and go see the gastroenterologists and GI physicians. And it was like, I sort of lived my life that last semester, just like waiting for the next doctor's appointment. And they just did the kind of conventional workups. What I learned is everything is kind of protocol based. You have to do this first. And if you fail that, you do this next. And that's sort of the process.
They didn't say anything. Like I was in Costa Rica and they didn't like immediately do something about that.
Yeah. And I mean, I did see like a internist sort of, and yeah, they did some kind of like post like labs, but maybe there would have been more things they could have done if I actually went to the hospital when I was experiencing the symptoms too, because I know now that your blood work will tell you things when you're actually like in an acute state of emergency too in the body. So so there wasn't a lot of like blood work or things kind of showing up post the fact. It was like the damage had kind of been done, and now I'm kind of trying to figure out like what happened. And long story kind of short, it was one of my friends who I had worked with for the summer in Chicago. Both of his parents were anesthesiologists at Northwestern. He deeply cared for me. We had spent a lot of time together in the summer, and he had reached out to me and was like, "You don't look so hot. Something's, going on." During this time, I will say I didn't really tell anybody what was happening, what was going on. I was just kind of living my life, trying to go to classes, extremely tired, trying to just finish out my undergrad degree. And in my mind, I was like, I don't even know if I'm going to be able to go to a pharmacy school at this point. But I just kind of hit all that and was just hoping that over the summer I would get it figured out with the doctors. And it was my friend who basically said that his parents would help me get a referral to the Cleveland Clinic in Ohio. And they're sort of like, they're definitely one of the top, they're like the Mayo Clinics, the top like digestive health facility, one of those top ranked ones. And it was sort of like, sometimes I figured out it's all about who you know in the medical industry. So they kind of expedited my whole case and all my paperwork and labs and my the tests. I mean, I had tests done, trust me. When I say I can empathize with people, I mean it. I had tests, I had blood work done. I had small bowel studies. I had tubes down my throat, tubes up my butt. I had every little study that you can probably think of in the gastroenterology realm. And when I ended up getting the referral to Cleveland Clinic, it was sort of like, we know this is rare, but we've had some cases similar to yours and we know how to help you. And so it was kind of a little bit luck on that part. I ended up going there. I ended up following through with starting pharmacy school, even though I was really sick. I finished that first semester, got through everything, and I had gone to my visits with the Cleveland Clinic in like November of the first semester. And when I got there, they basically just told me that I had this kind of really rare disorder where I probably acquired some type of bug that affected all the nerves in my digestive tracts, sort of similar to like a Guillain-Barré type syndrome where it can affect anything in the gastrointestinal tract with the nerves. Luckily, it was really, I would say, segregated just to the colon area. And they had done particular studies for me. I did a lot of like motility testing studies, but they kind of just said I didn't really have any type of peristaltic or nerve action or peristaltic action in my colon. So at that time, it had been, I'm like about 5'8", 5'9" on a good day. And I had been down to about 90 pounds. And so at that point, and if you can imagine, so I was like kind of a walking skeleton. At that point, they were just sort of like, well, you can either go on like total parenteral nutrition where you like carry this little backpack around and you get all your IV nutrition in this backpack, or we can do it's called a total abdominal colectomy where they remove your large intestine. Now, people can have this done for like severe ulcerative colitis, Crohn's disease, you can have portions of your bowel removed when there's severe issues. So it wasn't like I had that official diagnosis. It was just really this rare kind of motility disorder, what they diagnosed me with. And I was young at the time, 21 years old. So my surgeon was super awesome. She was a badass. And she just kind of said, you are young, you'll be able to recover. I've had a lot of success with this surgery and your body can heal. And the alternatives were just really slim. They just gave me there's not a lot of medications that can help this kind of condition. So I ended up following through with the surgery. I did a total colectomy and then I had a temporary ileostomy placed, which is where they just kind of pull a portion of your small bowel to your stomach and you have like an ostomy bag. And that's how everything works. And I had that for about 3 to 4 months. So it was a very traumatic time in my life. And after that, I really started to like hone in on just how important like a gut and digestive health is. And so I started to kind of deep dive a little bit further into how I could support my body better after I had this surgery.
Were you learning anything about gut health or anything like that during pharmacy school, or was this is all research you had to do on your own?
Yeah, great question. At the time, no, it was everything I had to learn on my own. It was sort of my own research. And what really led me to functional medicine, I'll say, is sort of after I started healing a little bit after I had the surgery. And then 4 months later, I had the reversal for the ostomy and things started healing up for me. I started to gain weight because I was just eating more regularly, going to the bathroom more regularly. And I gained weight back and then I started to get my period again, because before I was actually not having my period because I had lost so much weight. And it was like the very next year, in, I would say like May of, 20, or when I had the surgery, I had the surgery in December of, I think it's 2019 now, if I can remember. A couple of months after that, when I started gaining weight, I started getting my period back. And that's when I started having tremendously terrible period pains.
Oh, no.
So who knows if this was kind of, it was kind of going on, I would say, before that. But when you're younger, everybody just tells you that that's normal. When I was in high school, you get your period and it's painful, a lot of bloating, constipation, fatigue, back pains, acne, lot of PMS type symptoms. And that's just like a rite of passage type of thing is what people tell you. I know differently now. But that was when I had to dig a little deeper again, down the medical route, figuring out what this was. And I had basically started to talk to physicians about how I felt I had endometriosis, based on a lot of my own research. Mind you, I'm a grad student that has access to like PubMed articles and things. So of course I do my own research and was kind of self-diagnosing, but I definitely felt I was right about this. And so it was just getting a physician to listen to me at that point. It was also very difficult. I had doctors telling me that it was just a byproduct of my surgery and that things are going to be better for me just because I've already went through so much stuff with my digestive surgery. But really it didn't. I was doing, I would say, pretty well despite the major digestive surgery. It was really the menstrual related symptoms that I was exhibiting. My cousin's like a detective and she ended up getting me like a doctor's email from Texas. And this is where I'm at. I'm very like, I was a huge advocate for myself at the early ages in my early 20s. So I emailed this doctor and said, hey man, this is my case. I'm like, this guy's probably going to think I'm a wacko or something. And I emailed him and said, I think this is kind of going on. I'm doing pretty well. I've gained weight. Everything's kind of going good. I can eat, things like that. I'm not taking any type of medications from my surgery. But I have XYZ going on over here with a lot of these symptoms that are really screaming to me, like endometriosis related symptoms. Crazily, the doctor emailed me back and said, hey, we're like 99% sure that you have endometriosis. Gold standard really is a laparoscopic diagnosis for that. And so he's like, if you're willing to come out here, it was the Women's Hospital in Texas. He said, if you're willing to come out here, we will have you see our gastroenterologist, which was mind-blowing to me that they actually work together. Because a lot of times what you'll see in regular medicine is this kind of segmentation into we only work on digestive health or gastroenterology, and we only work in endocrinology, or we only work in cardiology, where they kind of segregate each component of the body. And so I went out there, did the laparoscopic surgery, and it was my first one. And yes, I had adhesions and growths all over my bladder and reproductive organs. And I had like my ovary was fused to my bladder.
Gosh.
And so, I ended up getting the official diagnosis then when I was like 21. And from then it was kind of like they asked me to freeze my eggs. And I was so young. I didn't really know what this meant. There wasn't a lot of education provided to me like after the surgeries, to be honest. It was just sort of like, okay, we kind of patched you up. We figured this out. This is what you have. And now you'll just have to manage this for the rest of your life.
So what was their recommendation of managing it?
Nothing. It was just kind of like, you just kind of have to take care of your body. And if you have the symptoms come around again, we can always do another surgery for you in a couple years. Which was mind blowing to me because, I didn't think anything of it. So here I go another 10 years later. And I found a place closer to home here, the Calda Center, actually here in Appleton, which was great for women's health for some of these severe cases. 10 years later, a lot of stress, a lot of different things going on for me, going through grad school, residency program. The symptoms had come back for the kind of menstrual related issues. And I ended up seeing them in October of 2021. And that was my second laparoscopic surgery for endo. And that was sort of my tipping point. After the surgery, I just said, this is amazing. I felt 10 times better. And I'm super grateful for what conventional medicine can provide in that aspect. But I can't afford these surgeries every, XYZ years. I am a very determined person. If it's something that I need to change with my lifestyle, nutrition, whatever it is, I will do it. And so when I talked to my OB-GYN about that after, he was just like, well, you can either be on birth control to control your hormones. Mind you, I had been in a 6-year very committed relationship when we were thinking about moving forward, actually, with getting married and having a family. But I wasn't quite ready to have kids, but because his other solution was just to get pregnant, and that's going to control my hormones, which was crazy to me.
So those are your two options, birth control or get pregnant?
Yeah.
Okay.
Or again, kind of come back and they can do the surgery again if it happens. And I really left that appointment feeling defeated. I went back. I was working actually at a tribal community health center, like when I had come back from residency program. went back to work a week later after my laparoscopic surgery, and one of my colleagues had given me a book, and I kind of share that too. The book is called Hormone Intelligence by Dr. Aviva Romm, and she is a very kind colleague, kind of older colleague, and had a lot of experience and wisdom. And she said, I know you're going through a lot right now, but you might find this book helpful, and maybe it can, help you with some of the things you're going through with these hormone related issues. And I read the book front to back, literally within a week, started implementing a lot of the recommendations in there. And within the first 3 months, I noticed this huge difference. I was having like normal periods, starting to get regular. It can take a little time to regulate things, which I always talk to people about, but they were not painful. I was noticing better like bowel movements, digestion, energy levels, all within the first like 3 months of just changing my nutrition, bringing some professional grade supplements on board to support my body. And I thought, wow, there must be something to this that I want to share with other people, because I can't be the only person that's going through this. I applied for a scholarship through the Institute of Functional Medicine. I joined, and I was awarded that scholarship.
Nice.
I joined the Functional Medicine Pharmacists Alliance during that time. And that's where I met this huge community of other pharmacists who were like-minded to me. And I did not feel alone, because you can feel very segregated, I think, when you start to have these like maybe different thoughts about like how to heal the body and health. And again, it's not anything like against conventional routes. It's just a different perspective. And to kind of answer your question, Brittany, functional medicine, what I learned is it really just takes a deeper look at root cause issues of what's going on in the body, marries your symptoms with kind of what's going on in the environment, basically helping your body recover and restore. And if you go on my website and things, that's really my whole philosophy, is trying to find deficiencies that are missing in the body, and we help replenish those, and we help the body repair any environment that may be damaged. And we look at toxicities, because there was another thing that was kind of going on deeper rooted in my history. I had long-term history of candida overgrowth in my gut, a lot of yeast infections, UTIs. My parents had a water damaged home, so I kind of grew up and I had a lot of exposure to kind of mold toxicity when I was younger. I didn't know that now, but I know that now based on everything I know about functional medicine. But I couldn't understand why I would have all these kind of allergy symptoms. And my mom would joke, like she knew I was awake all the time, because she said I would sneeze like 20 to 30 times when I would wake up in the morning. And come to find out years later, I have this like MTHFR gene mutation, and I don't eliminate toxins and things like that as easily as other people. So I have to support my body better. But, that's really getting into the depths and the weeds. But I had to really dig to understand why all these things had happened to me. And so when I met this community and I started going the functional medicine route, it was just sort of like no turning back from there. I kind of quit my job and I started working for a compounding pharmacy in the Green Bay area. It's called Custom Health Pharmacy, and it's great. You guys should check them out. But we do a lot of like personalized and customized medication. It's a lot of hormone support, functional medicine based things. It's all personalized to your body. And I found a lot of healing through that. And as soon as I started feeling that in my body, I just wanted to share that with other people. And it was sort of like I started organically sharing that with people at the pharmacy when they would come in and ask questions. And we sell supplements there. And it sort of just took off from there. I was sitting in my hairstylist chair, and she, I was giving her recommendations about things that she could do for her gut, because I had done gut testing for myself and figured out like what my microbiome needed and where I had kind of overgrowth in these things, and dealing with kind of candida overgrowth and those other things. And once I was able to heal from that, I started just sharing it with other people, anybody who would kind of listen. And she was like, well, Kim, you are really knowledgeable and great about this. Like, people would probably pay you to do this. I was like, no, I couldn't really do that. And every day it seemed like when I was talking about it, there was so many more people that could relate to this kind of similar journey. We're not all the same by any means, but we're definitely, some of us are struggling with similar issues. It's hormone imbalances, thyroid issues, stress every single day, gut irregularities. And so that's, yeah.
So why do you think so many people are struggling with those things these days? Do you think that, I mean, even 100 years ago, people were struggling with these things just as much? It's just people didn't talk about it as much. People kind of struggled in silence. Or do you think society has changed and that's why there's so much more struggle?
Yeah, excellent question. And that's a lot about that's kind of gets into the roots of functional medicine as well. Unfortunately, in our age today, I don't think there was as much struggle years ago, and the reason is because there's so much talk about it now. We have a lot of soil depletion. We have a lot more toxicities that we're exposed to. We have a lot more. I always kind of joke with my clients a little bit, or just tell them to help them feel validated. Like it's truly not your fault. Like a portion of it is not your fault of why you're here, especially for women, because we have a lot of exposure. I tell them to like xenoestrogens and endocrine disruptors. Your hormones sort of run a lot of chemical things in your body. And when they are imbalanced, or when they are kind of being messed with by external factors, that's what leads to these health issues and kind of imbalances. And so a lot of it right now is the exposure that we get every single day. So probably one of the primary things I'm talking to people about is really cleaning up the environment around them. I'm a huge stickler for it because it was pretty much one of the first steps I took to helping, myself with hormone irregularities and hormone imbalances. It was actually saying, okay, this seems a little bit arbitrary, but you know what? It is. It's coming from shampoos that I'm using every day, lotions that I'm putting onto my skin, candles. Like I can't even express like the amount of exposure you get from those types of things, because it's everything that we're absorbing through our skin, what we're smelling, what we're putting in our body, what we're eating. So I have to ask people to start to clean up their environment around them first. And that is not an easy task for sure. No, I don't tell people you're not going to go home and throw out all your stuff, because things are expensive, but slowly, trust me, in the process, slowly start to replenish these things. So when you run out of something, just say, okay, this time I'm going to make a mindful purchase. And that's a great opportunity to support local businesses too. There's a lot of I give people a lot of resources for that. And that's sort of my job too with my clients, is I'll give them specific resources and places to go, just so they don't have to do all the research, because I've done it.
For sure. And I think that your experience now is why so many people are probably attracted to what you're doing, because you've lived it and you've had to do all your own research and figure out what works and what doesn't. And now you can share that with the world. So returning back to your story, so you got certified in functional medicine, and now you've been a pharmacist as well as running your own business?
Yeah. So when I had joined the compounding pharmacy, custom health pharmacy in Green Bay, I had chatted with the owner, and they had a lot of opportunities through our chemical suppliers, because we do a lot of bioidentical hormone support there for people. And my boss was like, hey, would you like to, go get more education and training for hormone restoration and certification? I immediately jumped at that, because one, I was just like, I'm going to do all this for myself. And
Right.
then two, I'm just super nerdy like that. I love conferences and I love learning anything I can. And so I went and did that. The first year I started working with them, and oh my goodness, I met this wonderful, amazing group and community of, I always kind of joke, I'm like, these are all the happy pharmacists are. They're called PCCA, or Pharmacy Compounding Centers of America, but we did training there. And I specifically trained with Dr. Pamela Smith and Dr. Lindsay Berkson. They are phenomenal resources. So if you ever get to research their things, Dr. Smith has written 7 books about hormone balance and has 35 years of experience. And I just feel like she was extremely knowledgeable. And I do feel very well rehearsed and educated in my ability to speak about hormones, and through her mentorship. And so I did that training. And then I had done applying functional medicine in clinical practice through Institute of Functional Medicine. I ended up taking another certification. It's kind of called Beyond the Labs, and it's with Dr. Robert Kress, who's a pharmacist. And that's kind of more geared towards functional and lifestyle medicine too. So just a little bit more honing in on functional medicine knowledge.
So now that you're also working in this industry, what can you tell us, what are people typically coming to you for? Is it symptom based that they're coming to you for symptoms? So if we dig into actually functional medicine in general, and now that you are a professional here and you have all this experience, What are people coming to you for? And then can you help us understand, like, what is the typical flow of visits, or how do you help people?
Yeah, for sure. Definitely probably the two top things that people are coming to me right now are hormone balance related issues. So it's what we look at, like sex steroid hormones, I call them. So it's like estrogen levels, progesterone levels, your androgens like DHEA and testosterone, cortisol regulation. People don't realize that cortisol is also a hormone. And we definitely need to, make sure that's balanced, because we could have a whole podcast just about stress and cortisol and that. And then thyroid hormone as well. There's, I'm actually looking at about 8 to 10 markers for thyroid to really see how someone's thyroid is functioning, because it's the master regulator of your body and you really want that to be firing on all cylinders. And I kind of tell people looking at a single TSH lab isn't going to tell you a lot about your body. That's sort of the last lab that will go if you have thyroid issues. So I'm trying to work with people about prevention, right? And then also, yeah, I am seeing clients who are struggling with like Hashimoto's, endometriosis, polycystic ovarian syndrome, infertility issues. And the biggest one too is just kind of gut and digestive issues, constipation, loose stools, bloating, brain fog, fatigue. I mean, they're actually all related to what's going on in your gut microbiome too.
Well, lucky for us, we're going to be talking about gut health and
Yeah, we will in
hormones with
another
Kim here in
episode.
just a little bit.
Yeah. Do people ever come to you, even if they're feeling healthy, they don't have any symptoms? Do they come to you just to like get labs done and like see where they're at and get a baseline when you talk about preventative health? Or are people typically only coming to you when they're like, I need help now?
No, absolutely. I actually already have some clients too who are just like, they are maybe like elite athletes or like people who, yeah, they just really want to focus. Their primary goals is prevention. They're seeing like these increased rates in cancer, or they want to be like their best version of themselves. And so they really do. Yeah, they're coming to get like a baseline and see how they can basically continue to optimize their health. And so it's not always just, quote unquote, sick people. But yeah, I'm seeing all kinds of clients like that too. And there's a full functional blood work panel I'll look at where we look further in depth, like a full thyroid panel, fasting insulin levels. You want to look at like these types of markers because they're more preventative before you actually get to like having an elevated like hemoglobin A1C or things like that where you're pre-diabetic, or because you can actually look at some of these markers. We look at like a methylation marker to see how well people methylate, that's just a fancy word to see how well you can kind of detox things through your body. You can look at different hormone levels. And then we're looking at, when I do cholesterol, I'll do a cholesterol panel for someone, but I also do a particle count with that. So I can actually see what their risk really is, because it, depending on if people have like small sticky LDL particles or like large dense ones, there's a difference in how that actually can be related to their risk for cardiovascular events. So it's more of a panel that sometimes you don't always get run by your regular doctor, even though you want it. Like I'll say to my clients, okay, if your doctor can order these labs for me, like we're going to get the whole picture. And oftentimes, like some of their doctors will run them, and then other times I get pushback, like because they're trying to go through the insurance and things like that, and I understand. So I work with them on kind of all capacities and try to meet them where they're at. But great question. Yeah, it's not just people who are sick; it's people who are they really want to optimize their health for as long as they can.
So you work with their doctor, and do people just come to you for their health? Like, I mean, you're not a doctor, right? So
I'm a
you
doctor of pharmacy.
Right.
So, and people do call me Dr. Kim, and it's kind of makes me blush a little bit because I just like to be, I like to be where they're at too. The reason I started my business was honestly to kind of get away from this white coat syndrome type thing.
Right.
I want them to feel like we are partners in this on their health journey. I'm absolutely capable of running all the labs, interpreting all the labs. And some people, they choose to come to me as their primary provider. And that's their choice. And I do work with other providers who are willing to work with me. It's a tough question to answer because there are some physicians who are open to it. And they're like, oh yeah, great. You have this functional medicine centered kind of provider over here. I have this capability to kind of, order labs XYZ like through insurance, and we can support you in that route. And then there's others who are very closed off to it. And they do say things like, if you're working with a functional medicine doctor, I can't work with you. So I've experienced both kind of things, and I've had to develop, I would say, a little bit of a thick skin regarding it, but.
Wow. Yeah, that is incredible. If people want to learn more about you, where would they go to contact you or ask questions or learn more about you?
So they can go to my website. So www.innatehealingandperformance.com. Definitely sign up for my newsletter because I'm going to be releasing monthly newsletters in regards to free community events. I try to do so many free community events. Like I will give away so much freebie information because at the end of the day, everything is still personalized. So there's really not a cookie cutter approach to all. I can kind of give people like overview of things that I'm looking at. I'll say like, you can actually use XYZ herbals for this, this, and this, but they're not going to be for everybody because not everybody needs them. It really just depends on what's going on in your body. And there's not a single person who I'm working with and I've done functional, called precision health testing for that is ever the same. But so you can learn more there, and I will be posting little blog topics on my website, and follow me on Instagram. I guess trying to get better about social media. Definitely a science and math nerd, but that's part of business.
Yeah,
Sure is.
That's awesome. Thank you so much for sharing your story with us. Your story is incredible, and I think it's important to tell because it not only helps people understand where you've come from and how you've literally lived everything that you're teaching them, and you truly can empathize with whatever they're going through too. So stay tuned, everybody. We have 3 more episodes coming up with Kim. We're going to be diving into more details regarding gut health, hormone balancing, and then also toxicity within your own home. So stay tuned. We have more episodes coming up next. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.